These are difficult times. Donald Trump has warned, threatened the Iranians that if they do not open the Strait of Hormuz, he would bomb all their power plants. The Iranians, to their credit, have responded immediately and have said that if this is done, they would destroy the entire infrastructure of the Gulf countries and also that of Israel. So we are heading to difficult times. These are, in fact, scary times, and this probably is the reason why a hearing in the German parliament, Bundestag, has been missed entirely by all of us. This was 4 days back on the 19th of March. A committee in the Bundestag was questioning the former chief toxicologist of Pfizer Europe, Dr. Stern. The first question that was asked was whether the Pfizer vaccine, the RNA vaccine, was tested for carcinogenicity. The answer was no. The Pfizer vaccine was not tested for carcinogenicity, which means that they had no idea whether their vaccine could trigger cancers in the human population. The next question that was asked was, has Dr. Stern noticed the fact that the birth rate in Germany and other countries has gone down after the introduction of the Pfizer vaccine? Dr. Stern answered that yes, he was aware of this, and the reality is that there were no animal studies done to check on reproductivity. There was one or couple of rat studies done which were not up to the mark, and the company decided internally that they would look out for side effects of the vaccine after it had been distributed in the public, and this is called a post-marketing surveillance. And what actually was found was that in the first 2 months of the vaccine rollout, more than 1,000 people were assumed to have died because of the vaccine. In fact, the Paul Ehrlich Institute in Germany received more than 2,133 notifications of vaccine-induced death. Now, the Americans have a factor that is an under-reporting factor, which means that because vaccine deaths are invariably underreported because they are missed and are not recognized as such, and this underreporting factor is 30. So if you apply this to the German situation, we have more than 60,000 vaccine-induced deaths in Germany, and these deaths were after the vaccines were rolled out. The committee asked Dr. Stern then whether he is aware of any benefit-risk ratio with the vaccine, because that is what the courts are telling people who have filed suits in with the courts demanding compensation for their injuries. Dr. Stern replied that in fact there is a mathematician in one of the universities in Germany by the name of Robert Rockefeller, who has calculated that for every severe COVID case that is prevented by the vaccine, there are 25 serious adverse events. Then the committee asked Dr. Stern whether there has been an increase or decrease in the mortality in Germany after the introduction of the COVID vaccines. The answer was that there has been a significant increase in age-adjusted mortality because of the COVID vaccine, because of the Pfizer vaccine. in 21-22 as opposed to 2020. Now remember, I am simply simplifying and summarizing what was the exchange between the chief Pfizer toxicologist and this committee in the German Bundestag, and we presume that the good doctor, the good toxicologist was speaking the truth. So to summarize, we find that the vaccine was certainly not safe or effective. I am talking about the Pfizer RNA vaccine. And lastly, another loaded question was asked as to whether the vaccine which was used during the trial before it was distributed to the public, whether that was different from the one which was given out to the public. The answer was yes. The vaccine that was employed during the trial before it was approved was actually a more purer form of the vaccine, whereas the vaccine which was given to the public was not as expensive as the one which was used in the approval trial, and the one that was used in the public was an impure form which was cheaper to produce because it was made using a bacteria, and that is why it was contaminated by plasmid DNA, which is an extra nuclear DNA. The problem is, Dr. Stern says that this is the reason why the rates of cancer have increased in the public following the rollout of the Pfizer vaccine. Again, I repeat, these are not my assumptions. These are not. This is not a summary of mine. This is what has been said to this committee in the German Bundestag.